Hi, thank you so much for coming on Spilling the Teeth. It's been so good to get you on the show. Really, really excited about this one. But for those who don't know you, can you just share a quick intro into your role, what inspired you to start the Graduate Dentist podcast, and what you've been up to?
Thanks, Alan. Thanks for having me on. And I have to say, I really, really love the title of your podcast. I had a good giggle at the pun of it, so appreciation there. But for those that don't know, my name's Erica Hwin, and I'm currently in my 4th year of private practice in Australia, and I run a platform called The Graduate Dentist. Now, how this started was I've been podcasting for quite a number of years now, and for a long time I saw myself as like a facilitator, as just someone there to ask questions for the guests. And I was doing this as a dental student, and over time I didn't realize, but people started to keep coming back to the episodes that I was and keep coming back to the podcast because they liked hearing my journey as the dental student. And I'm quite open and transparent, and even whilst interviewing guests, I just share, oh, I got stuck in this today, or this is what I struggled with. And I slowly realized that was what was missing in our industry, is that, oftentimes we're talking to the industry leaders and the experts, and there's so much wisdom that is out there, but people don't often talk about the new grad journey. And people don't talk about how difficult it is to be a dentist, particularly in your early years. And so I realized that I wanted to start sharing my journey, because I realized it wasn't unique, and that the challenges and the struggles that I faced going from that dental student into a new grad were not my own. But when we don't talk about it, it's very easy to feel isolated, and it's very easy to feel that imposter syndrome and to be constantly comparing yourselves with everyone else. And so, yeah, that's what the Graduate Dentist was born out of. That's the heart of it. It's to create your go-to guide through real-world dentistry, and most importantly, a community for grads.
Yeah, amazing. And I mean, we were speaking
Mm.
before the recording, and I was saying like, it's just the wholesome side of dentistry that you don't
Yeah,
often
that's
see.
right. Mm-hmm.
And the losses and the wins, like all together, it builds such a nice picture. And I think
Mm.
nowadays, especially, I mean, every country that I speak to has the same problem, right? It's recruitment in dental, and a lot
Mm.
of people stop thinking about those new grads, those new starters, and they forget the journey that they're being on. Actually, by focusing on this, you can actually help that recruitment journey as well. So, um, yeah, that's fantastic. Really love what you've been doing. So thank you for giving that back to dental.
I know. I think I very much believe that we're all in it together, and sometimes with time and experience, you kind of forget what it's like to when you first started. And so I've evolved from I'm kind of at this special moment where I'm evolving from being that graduate dentist to now kind of being on the other side. Like I'm going into my 4th year now, and now being in the position of being able to give back and look after our next generation of graduate dentists. And whilst I say very openly, I'm no expert by any means, but I'm just a few pages ahead. And I think sometimes that relatability of, I remember what it's like to be your first day of work, or I remember what it's like. I'm still in that position where you get stuck with clinical procedures, or you're not sure about a decision that you're able to make. And so it's nice being able to, in some ways, be a bridge between the students and the new grads, and then those senior dentists who have this wealth of wisdom, but are just a little bit disconnected sometimes with the younger generation. And yeah, I'm very, very lucky and privileged to be in this unique position.
Yeah, do you think that's what
Mm.
keeps motivating you to push the graduate dentist forward, like being that bridge, being that connective tissue almost, between
Yeah, it's a
between the two
good
worlds?
way. Yeah, I think so. I always say to people that yeah, I kind of fell into this whole role of being the graduate dentist and being a podcaster and having somewhat of a social media presence. But anyone who knows me and my family and close friends will say that I'm very much an introvert in some ways, like a private person, or I keep to myself. So I kind of fell into it. And sometimes it feels a bit, I don't know, like I don't know what the word is, but I'll go out to courses and I'll meet people, and I'm like, oh, I didn't realize that so many people listen to the podcast, and I don't realize that there are that many people that are connecting and resonating. But that for me is the drive. That's the fire. That's the fuel that says, actually, the fact that I'm able to have some sort of an impact on people just by being open and being transparent and being able to connect people together, that's so rewarding. And yeah, that's the bit that's driving that passion and that fuel of just constantly creating. And I don't know, I feel like we're onto something, and it's so rewarding hearing messages from, like reading messages from people, or people coming up to me in person saying, oh my God, like I love listening to your podcast on my drive to work, or I had such a terrible day and then I saw a post that you made and it just made like me feel so much better, or all those worries melt away. It's so nice to know that I'm not in it on, like I'm not on my own. And so yeah, that's the driver.
I mean, that's amazing. We all know
Mm,
one of the biggest struggles as well in dentistry is mental health, and if we can make a small impact on that,
that's
then
it.
fantastic. That's really why we're all here, is to help people have a better time doing dentistry, as well as helping
Yeah,
patients.
that's
Yeah.
absolutely it.
Okay, so on this season of our podcast, we're talking about leading with purpose. We're talking about
Mm,
leadership in dentistry. Um,
mm.
I'd just kind of like to ask you before we kick off and we get into the nuts and bolts of where you fit in here, is like, what does leading with purpose mean to you? What does leadership in dentistry mean to you?
It's something that I feel I'm learning over time. But I think a sign of a good leader is someone who's able to inspire and then positively influence those around them. And I think someone who's like a huge role model of mine, who I think is a wonderful leader, is actually my boss. And the reason being is the reason why I took up a job with him and knew that, hey, this is going to be my, like, as a new grad, they would say your first job really sets the trajectory. And I knew this is the person that I want to have in my corner is because I knew he was in my corner, right? And even as a student, it was his ability to, I guess, see potential where I didn't even know I had potential. And he would say to me, like, in some ways, you have that belief in you. And I think that's like, yeah, a sign of a good leader is someone who believes in you, even when at times you don't believe in yourself, who's able to inspire you and who has this vision that gets you on board with it. And I think that happens across like all aspects of dentistry, whether it's with, a practice owner who's hiring an associate, them having a vision of this is the kind of practice that we want to run, this is the kind of dentist we want to be, the kind of care that we want to deliver to our patients, and then to be that inspiration for an associate who wants to come on and be like, yeah, I want to be like you. I buy into this message, I buy into this vision that you have. But then, we can push it further to saying like leaders within like the industry in terms of teaching, right? Hey, this is a way that I want to do dentistry. This is my dental philosophy, how I do a particular procedure. And then being able to not only teach it, right? But I think a sign of a good teacher and therefore like a good leader is to be able to empower those around them to be like, you can do it too. If I can do it, you can do it as well. And so that's what I've been seeing is in throughout my journey in exploring this idea of leadership, is those that are able to rally people together in like a common purpose or a common vision, and have them, just have that enthusiasm and excitement and that energy of like, hey, I can do it too.
Yeah, no, I
Mm,
totally agree. So that inspiration sort of begats better work as well, and
mm,
I think that's sometimes what we're missing. We lack the inspiration to inspire ourselves as well,
mm.
and you can sort of see that a lot in dentistry, and that's one of the big reasons we started this podcast, and obviously one of the big reasons you started yours is like actually giving you the tools to inspire yourself so that you can inspire others in turn as well and become that leader that you maybe were born to be. No, that's
Mhm.
really, really good, and I love that you touched on the teachers there in the universities, the colleges, because they're some of the first leaders that you come across, right? Exactly like you said, you've started started to go into the world of dental, and the first lead that you come across is the person teaching you the first set of skills. Um,
Mm,
but I think we're starting to see a little bit of a disconnect in that world, and I think that
mm,
sometimes when you're taught the practical skills, you're sort of not taught those soft skills that we're talking about here, like the inspiration for behind what you're doing, the drive behind what you're doing, and how to deal with mental health as well. But I think what I want to really ask you is like, what are some of the things that you see as gaps in the university space or the college space, and what's something that no university or college could ever prepare you for in the world of dental?
It's exactly like what you've said, Alan, right? It's the soft skills. Uni teaches you the technicalities. It teaches you to be a safe clinician. It teaches you textbook, but real life is not textbook, right? And at some ways, I guess you can't fault the university system because their goal is to standardize the dentists that they graduate and ensure that we're all calibrated and that we're all, people going out into the workforce who can safely practice dentistry. And there's only so much that you can do within the model and the university model, and particularly for something like dentistry, where when people go into the history of it, where it's a branch off of medicine, you think about any other uh, profession within within healthcare, where there's that aspect of studying, but then you come out and you're in a team environment, or you have an internship year and you're kind of always supervised, or you've always got other people that you can go to. But I think one of the unique things about dentistry is it doesn't matter if you're one day out or 10 years out or 30 years out, like you're the decision maker in that room. And I think that's probably the scariest thing leaving university is you go from having someone over your shoulder telling you what to do to now being the decision maker and having a patient on the other side. And arguably, I think it's the most underrated part of our profession is just how much pressure there is in that to be the decision maker, and you have a patient who's so nervous and so anxious. It's such a vulnerable and such an intimate, in such a vulnerable and intimate position. And, there's so much anxiety that we have to deal with and so much pressure and stress, right? And so uni never prepares you for managing that, managing the stress, managing the communication. And when we talk about things that don't get taught in university, it's really the patient communication side of things, the patient care. How do you look after someone who's sitting in your chair, who's anxious, who doesn't understand dentistry? It's complex. There's so many things. There's so many details involved with it, right? But uni teaches you what's textbook perfect. They teach you the procedures and stuff. And then in some ways, they don't really prepare you for, okay, well, what happens when things don't go according to plan? Because the more you do dentistry, the more you realize more often than not, things don't go according to plan. But I think by nature of our profession and the type of people that it attracts is where all those perfectionist mindsets, the people that get into dentistry are top of the class. They're the ones that like their, everything crossed and checked and perfect, right? And you're there in sim clinic learning on your models and you're fixating on getting it perfect, and then your tutors need you to get every step perfect, and then you're not equipped when you go into real life practice when things aren't perfect. What do you do then? How do you communicate that with a patient? There's that.
Yeah.
There's a lot. I don't know if I managed to summarize it all for you, but I think that's just like a little taste of all the things that disconnect between uni and real world practice.
Yeah, no, I totally agree. I totally agree. I've spoken to a few people on the podcast around this topic, and one of the things I spoke to someone about what was exactly this, and they said actually when you're building a practice, say you're starting out a greenfield site, or you're going into a practice as even as an associate, um, one of the first things you should invest in is not a brand new set of scrubs. It's not, if you're the owner of the practice management software, it's not a new scanner. It's actually a really good therapist, because actually the biggest investment you should make in is yourself. Because they can teach you some of those soft skills. They can teach you how to look after yourself, but also, they can help you work through when things go wrong, when you've got that perfectionist mindset. Like scaling it back and going, okay, did I do everything I could do? Can I be sure that this was the right course of action, that kind of thing. So no, I totally agree. University might not be the best place for all of these things, but we can definitely make the effort to invest in ourselves.
Mm-hmm.
Do you think that some of these impact not just yourself but the team dynamic? Does a poor mental attitude, or not being set up in the right way, does that affect the rest of the dental team? Do people bounce off each other in the practice setting?
Yeah, 100%. And we you think about it, it's such a high stress environment to be in, right? And this is where I think having a good team around you is so crucial to yourself, but also like the patient experience. Just, someone said to me very early on that as a dentist, it's not just you and your patient, but your dental assistant is just as important. Reception is just as important. And the other auxiliary staff members, the other dentists within the practice, like it all impacts it, right? And I've been talking about it quite a lot recently, even on my own podcast, about the importance of each and every one of those relationships, right? Like you think about just the importance of having a good relationship with your dental assistant is that it's the two of you for the whole day together, right? And you have to be on the same team. And I've been through it where you have different dental assistants, and you need to make sure that you're both on the same team
Mm.
because when you're not on the same team, then how are you able to look after your patient when the two of you are on the same page, right? And so I think one of the key factors of a good day is when, or yeah, just like smooth operations is just when you and your dental assistant know like you're in sync, you're on the same wavelength, you have the same attitude, you know that both of you, like the end goal is to look after your patient, right? But if either one of you is not in that mindset or that frame of mind, or you're not on the same page, then everything falls apart, because then it suddenly becomes like, why are you talking to me that way? Right? Or what do you want? And how can you be a good team when the both of you aren't getting along, right? And then that translates over to reception as well. Reception's there trying to manage the phone calls and trying to manage patients coming in. And if you're not communicating well with them because you're in a bad mood, then it falls apart from that end of things. And then you bring it onto like, okay, what about the other dentists? Well, I think it's so important to be like in a collaborative working environment with the other dentists within your practice as well, because when you're able to bounce ideas off one another, right, that's when you grow. And we come back to that inspiration, right? Like you are the sum of the people that you surround yourself with. And so if you're in a team environment where everyone's just like, hey, like let's do better, and they're motivated and they're driven and you've got that camaraderie, then yeah, your overall just mindset and attitude is it's so much it's so much better, right? But when we talk about your mental health not being the greatest or your mindset not being the greatest, then you can see how quickly you can just become a hermit within your own dental practice, where I've seen it, right? You go to work, you don't really have much of a relationship with reception. You walk past reception, you go into your room, you don't talk to your dental assistant, maybe because you don't have a consistent dental assistant, right? And then you're just there, and then you don't talk to the other dentist, you go sit in your car at lunchtime, and at the end of the day, you go home, right? Like that can very easily happen. And I think that's when things break down. That's when people burn out. I think everyone is connected, and one thing, if it's the butterfly effect, it will happen. It's cascade and affect everything else.
Yeah, I think that's
Mm,
one of the things you hear so much is dentistry is a lonely profession. But I
mm,
think a lot of people do forget it doesn't have to be lonely. Like you said, there's all of those people around you, and yeah, not all of them are dentists, but actually all of them are your team,
mhm,
and that they should all be on your side. So I think it's a really, really good point, and that's a mindset that a new graduate should be taking. Right? It's not, "Oh, I'm about to go into the loneliest profession." It's actually,
mm.
I'm about to join a team, and we're about to
Yeah.
make amazing things happen. Is that
Mhm.
is that kind of mindset? Do you see that often enough, or do you think that maybe somebody should help G them up a bit more to have that mindset? But
I think it's hard. I think the struggle of every new grad is trying to land yourself in that perfect job. And I think
mm,
every new grad wants to. There's that decision paralysis and of I want to make sure I'm in a job where I've got a good support system and there's good mentorship and I have people in my corner and there's good workplace culture. But then you want to make sure that your books are busy because you still want to be practicing dentistry and you want to be remunerated well and you want the practice to have like pretty good equipment and this, that, and the other, and it ends up just becoming, oh, it's it's that whole comparison thing, right? Where I
yeah.
think people often then worry about like, do I, have I made the right choice? Am I in the right position or not? That's I think oftentimes the challenge that I see with new grads is being unsure whether they've made the right decision in where they are working. Yeah.
Yeah. Yeah,
Mm,
no, fair enough. Fair enough. But I think what I'd like to explore as well is
mm,
the other way round, I guess. So these are
mm,
maybe some of the misconceptions that new grads have, is like that choice is like the toughest thing, and finding the perfect situation is the best thing to do. But what are some of the misconceptions people have around young dentists sort of entering the profession? Like you're a practice owner, you're hiring your latest associate, they're fresh out of college. Like
Mm.
what's the misconception that I'm having about that person at that time?
I think this is so fun. This is we're gonna take a little bit of I went down a bit of a deep dive or a rabbit hole in this, Alan, because a few months ago I was invited to speak at a dental practice owners conference, and the topic was exactly this. Like, for practice owners, they're like, Erica, as a new grad, what do you think the workplace and motivation desires are of a new grad? And as practice owners, what should we be looking out for with our grads? And the more I broke it down and the more I spoke to these practice owners, I realized that there's this big, that misconception of what grads nowadays are like, because grads nowadays are Gen Z. And
Yeah.
Gen Z sometimes have a bit of a bad rap around it, and particularly when your practice owners are like the Gen X's and the millennials, right? The common misconceptions or stereotypes that they have for Gen Z are like, "Oh, they're all entitled, they're all lazy, they're all soft and sensitive snowflakes, and they'll do the bare minimum and expect everything." And that was almost unanimously, every time I spoke to any practice owners, kind of what they thought about our generation. And whilst, yes, there are aspects of it that, I can understand and appreciate, the other side of it that I see is that this new generation has so much potential. And I think they will far surpass any prior generation. And it's purely because of just the amount of access we have to information nowadays and the standard of dentistry nowadays compared to what it was beforehand. And a lot of this is attributed to just social media and the internet and the ease of access to information, right? And you compare that to previous generations where they didn't have that, right? If you really wanted to go find information, you had to go, I don't know, go look up textbooks or find research papers and attend a course. But nowadays, in the morning before we go work, we can scroll Instagram and already consume hours of CPD just off of our phone and learn so much from people just on the internet and connect with people from all sides of the world. And we're learning at such a rapid rate. I remember sharing these practice owners that, and for us, like when we go to uni and we listen to lectures, like gone are the days of sitting in an in-person lecture. Like everything's online now, and the way Gen Z process information is so rapid that I was like, we listen to podcasts and lectures on 2 times speed. And they're
Yeah,
like,
yeah.
what? How do you understand that? But I'm like, that's just the new generation. They just process information so quickly. And so when you understand that side of it, you can see where there's that double-edged sword of our generation is incredibly, have so much at the tips of their fingertips, and as a result are so driven, are so motivated. There is so much of just like this desire to make something of themselves. I think everyone in Gen Z, like, they want to be like the main character of their own story, right? So there's that kind of attitude, I think. And at the same time, because of that, because of social media, the negative side of it is that constant comparison and that overstimulation and the overwhelmment of it, of just, I'm not doing enough or I'm not good enough. I said before, like, you could be in a great practice, but then because of how easy it is to see everything else going on, you're constantly turning your head around and being like, but couldn't there be more? Could I be doing more? Is it better? Is what they've got better? That's the tricky side of it. And so when I talk to these practice owners and try to explain both sides of the story, it's kind of have that understanding and that empathy on both parts.
Yeah, no, definitely.
Mm,
It's just such interesting points. I mean,
mm,
listening to
mm,
you talk through those, I was
mm,
just thinking back to an episode I did with a DSO in the UK called Love Teeth. They
mm,
were talking about social media, and
mm,
social media is now accounting for like 80 or 90% of their bookings, right? So
mm,
the
mhm.
majority of their bookings are coming directly through social media for, smile improvements or dental work in general. And that shows a real shift, and actually bringing on those Gen Zers, like the TikTok generation, like some people might call them, is like actually it's actually a benefit. Like you're getting more people through the door, getting more patients through the door because they know what they're doing in that space. But yeah, it is
Mhm.
that double edged sword because they know what they're doing, they're also looking at what others are doing and comparing themselves. Um,
Yeah.
do you think that that's what causes some expectation differences around generations. The previous generations might have been like, I expect a really good CBCT scanner, and in this generation we might be going, why is my practice not on social media? Why is it not looking for patients for a new direction? Do you think is that what causes the shift?
I think there's definitely, yeah, a shift in a skewed perception of dentistry. And I think previous generations, before all of this, like needing to have a social media presence and stuff, I think a lot of people went into dentistry thinking kind of, oh, yeah, you're a dentist that just does scales and cleans. Like that's what being a dentist is, right? Like you do your scales and cleans, you do your checkups, you do a filling here and there, and yeah, that family dentistry side of things. But then now, because of social media and everyone putting themselves out there, and there's almost like the glitz and glamour of, these smile transformations, and there's this. At least I know, and I don't know how it translates to other aspects of the world, but at least in Australia, it's just, the standard of a good dentist is different now because of what you're seeing online. And so, yeah, perhaps as you said, it's just, oh, a standard of a good dentist or a standard of a good dental practice is just now how attractive it is or how well it's presented to patients online. It's different. Yeah, and I think and back to your point is it's that influence of what you see, because all you see is all you know, right? And so I think in some ways it's skewed, because when you just see what's on social media, it's just it's the highlights, right?
Yeah, yeah.
And so I think perhaps there's at times a bit of a disconnect where new generation dentists see all those highlights, all the flashy, the prettiness, and expect that that's what all day every day will be like when I start working in dentistry. But for those senior dentists, it's like there's that part of it, but also there's the unglamorous side of it where it's like, building your practice from the ground up, investing in those patient relationships, those long-term retention of them coming back, doing the not so fancy stuff, but the groundwork that no one sees, but is what is important to ensuring your practice succeeds long term.
Yeah, absolutely.
Mm,
Absolutely. Yeah, I spend a lot of my time talking to dentists, whether it's at trade shows or it's in practice or,
mm,
over the phone. And but I also have spent a hell of a lot of time talking to young dentists.
mm,
And I do see that shift in the expectation. And, I might be showing some X-ray, AI imaging, whatever it might be, and the older dentist is, "Oh, that X-ray's come out quite good. What's the machine like?" And the newer
mm,
dentist is like, "How's the AI working? Who coded it?" Like all that kind of stuff. So
mm,
really seeing that difference in interest.
mm-hmm,
But one thing I guess I don't see so much is are the current leaders, the older generation of dentistry, sort of tapping into that really effectively, and sort of tapping into that expertise that's coming through as well. So
mm-hmm.
what's one way or one thing people like these leaders can do to help tap into that and start making the most out of the wealth of knowledge that these young dentists are bringing through?
It kind of comes back to that collaborative effort, right? And I think another one of your earlier questions for me before, Alan, was just what do you think is a sign of a good leader? And I think a sign of a good leader, and like we were talking before about good educators and course providers. And very recently, I was at a course where it was like taught by this dentist who's lectured internationally all around the world, very very highly regarded and renowned. And he made a comment about how he's like, "Don't quote me on something I said 5 years ago." He's like, straight up, don't listen to me now, but don't quote me on the things that I said 5 years ago. So I don't believe in the things that I said 5 years ago. And he's like, I'm constantly upgrading, constantly revising my lecture content and my material, and constantly diving into just the newest technology or the newest research. And I had a moment there where I said, that's a good educator, is someone who is constantly evolving and constantly refining their craft. And I think very often, there are some leaders or some, people out there where they figured out something that worked out really well and became very well known for that one thing, and then have just stuck by it for years on end.
Mhm.
And 20 years later, they're like, this is the tried and tested and true way. That's it. And I think that's kind of where the pitfall lies, in those dentist where it's you have so much to offer, but you have to also be open to just new these new innovations and be willing to accept it. So so often you'll hear dentists who and let's just you come back to what we were talking about, social media, right, where they're just like, I built my practice before social media, right? And we were able to build it to what it is now. I don't need to get on TikTok. Or I don't need to go, film these reels or do all of these things. And they kind of just, in some ways, shame it or brush it off as being silly. But then it's like, but then you're not keeping up with the times, right? And then you're just stuck in your ways and you're missing out on just the potential of taking all of the wisdom that you had, all the things that allowed you to be successful, those principles, taking them and then just translating them into and adapting them into just more modern day techniques. And if we draw a parallel in dentistry, people often say, like, nowadays, you talked about AI or about scanners nowadays, but people often say that, like, these only work well if you understand the analog techniques that came beforehand, right? And so the same kind of thing translates. It's just like, for those dentists, you had the way you understand those principles. There's so much, you have so much knowledge that you can still impart on this new generation if you're just willing to, accept and be open-minded to just a new way of thinking, of a new way of doing things. And you can then marry what you have with just this younger generation who understand technology or understand different ways of seeing things. And I think that collaborative effort opens up just so much opportunity to do really great things.
Yeah, yeah, totally. I think one of the key things, exactly like you said, I built my practice on word of mouth. Well, social media is word of mouth now.
Yeah.
That's
It's just a different
that
way. It's just a different
exactly
way.
that. Yeah,
Yeah.
make the comparisons, like you said, use the old school to what was your new school, and now take your old school to put it to what is now new school, and
hmm
you'll see that things just evolve, and you just need to be part of that
But just
evolution.
it's based on the same fundamentals. It's like it's the
Hmm.
same message just through a different modality, right?
Exactly that. Exactly that.
Mm, mm,
Okay, so we're getting to the world where these younger dentists, they've been brought into a practice. Their expertise are being used. They're looking after the dental practice in a world of technology, and maybe now they're looking to be a young practice owner. They're moving into that stage of life now, and we're seeing year in, year out across all countries practice owner age is coming right down. It used to be in the 60s. It was last year in the 50s, and this year it's looking like it's in the 40s. So that average age is coming down. So they're just coming in, and they've come from a world of trying to do it all, and now they've got to do even more.
mm,
And this leads to things like burnout, right? And this is
mm,
something you've talked a lot about. We've talked about today, but you've talked a lot about before.
mm,
Um, and when you're the leader, that's really hard. Like
mm,
it's really hard for you to notice in yourself, because it's quite hard to notice in other people. So,
mm.
what are some signs of burnout that you should look out for when you're looking at yourself? But also, before you get to that stage, what could you look out for in others to sort of help them before it gets to that stage?
I think it's I'm thinking about like an example from earlier this year, and I'm very grateful for it. But my practice manager called it out on me. And so I guess that's to answer your question, or exactly what you were saying about someone else noticing a change in another person. And so it was at a period of time where I was just very overwhelmed with having overcommitted to myself to too many different things. And yeah, my practice manager ended up just coming into my room. I can't remember if it was because she ended up asking me about something. And I think it was because it was something I wouldn't normally do. And I remember
Hmm.
being almost a little bit defensive in that moment and trying to and panicking because I was like, no, that was not my intention. Like my intention is never to be this way or anything. But it was I think she was watching it unfold. One, me doing something that I wouldn't normally do, and then her approaching me about it and then seeing how worked up I was about it. And then she then had a private conversation with me about just how are you doing? Because she's like, you don't seem yourself.
Mm,
And I
yeah.
think that's usually the first sign of when you're more irritable than you normally are, or you're less patient and you give people less grace. or you're not as interested in the activities that you normally would be. Normally your friends will say like, "Hey, do you want to go do this?" And you say no because I'm busy or this, that, and the other. So I think it's that change in the norm, and sometimes it's subtle. Yeah, and I think maybe for myself it was I don't realize this because, as you said, you don't know how you present to the rest of the world. But people often say it's very obvious when Erica's not happy because my highs and lows are quite polar extremes, right? And so it's quite obvious to those people who know me, right? But to others who maybe they're a little bit more neutral most of the times, those differences may be a little bit more subtle. But from an outsider, I think we are often everyone's kind of just thinking like in their own worlds, and so I think when you're a leader. It's important to, whilst you're busy and juggling all these things on your own, just to kind of have a little bit of an eye out for the people around you, your team around you as well, and picking up on those little things. When someone's just being a little less than what they normally are, because people rarely will openly just speak up about having a hard time. I think, unless you've created just like a safe space where you openly and frequently talk about these things. I think some people feel awkward if it's not something you normally talk about, then why would I suddenly bring it up? Right. Um, but those subtle things, and I don't know, I'm a big believer in just having these open conversations, and I think oftentimes the way that I connect with people is always by being vulnerable first. And then by being vulnerable, it's an open invitation for the other person to therefore feel, oh, I'm allowed to share in this space. And so that's
Yeah.
kind of like, if I were to provide advice about like how to approach those kinds of conversations, there's one, if you notice like that little subtle difference in the way someone is, and then just having that like private conversation, maybe sharing a little bit about yourself and like, hey, this year's been really hard, hasn't it? And then from there, just giving someone that space to kind of open up themselves.
Yeah. No,
Mm,
that's a really good point, and I think it's something that we can look inwards for as well. Like,
mm,
we're all creatures of habit. We know what we do day to day, and
mm,
actually, if we have a slight change in habit that throws us off guard ourselves, like, oh, I wouldn't normally do that, or why did I do that, or why do I
yeah.
feel like this?
Mm,
That's when you have to go. Maybe I need to take a step back. Maybe let's just have one less appointment today, and I'll go for a
mm.
walk or something like that to try and calm yourself down and bring yourself back to earth before it does get to that burnout stage and it gets
It's
way bigger than it needs to be.
that little like cross checking of yourself
Mm,
or accountability of exactly like you said. It's just like, oh, I I retaliated in that situation a bit more. I was a bit more volatile than I normally would be, and it's easy when you're busy to kind of just be like, oh, but I'm busy, and like just to toss it away and then not think about it. But you kind of have to pull yourself up on it and like, but why was I like that? Or,
mm,
why did I get really upset about this? Why did I cry over this when I normally wouldn't be? Why was I offended by this comment that someone made when I normally wouldn't be? I think it's, not just ignoring it and sweeping it under the carpet, but kind of, pulling yourself up on it and like, this is out of the ordinary. Well, is there something deeper than that?
yeah. And like we
Mm,
said before, like, we're not just a solo dentist anymore. It's not just me in the practice, doing some work. It's actually a team. Like,
mm,
this is a full practice. You've got your receptionist, you've got your assistant, you've got your
mm,
nurses, you've got the other dentists. You've
mhm,
got your practice manager, you've got all these people. So
mhm,
no, I lean on these people.
mm.
Don't use them, but enjoy their company and take on their advice as well. So, um, yeah, fantastic. Okay, and we
Mhm.
talked a little bit there at the beginning around how, younger dentists are now moving into those ownership roles themselves and they're beginning to shape the future of dentistry. So I guess one of the questions you always have to ask on a podcast like this is like, what does the future look like? And what do we think that those young dentists that are coming through now that will be changing the world in the next 3 to 5 years, what do we think that future's going to look like? I mean, you've seen it yourself. The last 4 years, the future that future's changed quite a lot. So what do we think that's gonna
Mm.
happen in the next 3 to 5 years?
I think like we were saying, just like that standard of dentistry nowadays is so different. Like I was at a course recently and there were just this one of the delegates there was saying she's 14, 15 years out and she's only learning to place implants now. because the idea of placing implants in your first second year, she's like, you would have been shunned by any of the senior dentists around you for even looking at an implant, let alone think about placing one. Whereas nowadays you've got people in their first year and their second year who are aspiring to do that, who are doing that and then doing it very successfully as well. And so it's back to what we were saying about that access to information and access to resources and learning, and armed with that drive and ambition. There is that general dentists nowadays, I feel like, have the ability to become these like super GPs of being able to do
Mm,
a lot more comprehensive work, offer a lot more for their patients there. Um, there's also that just innovation side of things as well, where we talk about just that understanding of social media, understanding of having a personal brand or having a presence there. I see so many students nowadays who are, creating their own marketing agency or creating their own, tool, or they're so just attuned to like seeing these little gaps in dentistry. I'm like, oh, what's a product that we could create to help our patients? And because that the ability to do so now with technology, with AI, it's that barrier to entry is so low now. Anyone can do it. Anyone with a phone and access to internet, right, can pretty much do these things and create it and put themselves out there and put it online. And so there's so much just room for innovation nowadays. Where will it look like in like 5-10 years? I really don't know, Alan. I really don't don't have an answer for what it will look like. I'm excited for it. I think there'll be it's an exciting um part that we a time that we are a part of, with all these advancements. And I always think about, what do we do nowadays? Like, what do we do now that will become obsolete in 5-10 years time? Maybe the scanners that we're using right now are going to be just ancient history in 5 years because we've got another way of doing things. I wouldn't be surprised if we do, right? And with all the advancement in AI nowadays, and people talking about using it to diagnose radiographs, or using it to diagnose on scans and compare things and take notes for us, and being able to provide input in your consults and everything. It's almost a little bit scary, but at the same time, there's so much just potential out there. So there's so much. I don't have an answer for what it will look like, but I just know that with the attitude and the mindset that this generation has of innovation and creativity, is that it's a changing landscape for dentistry. And hopefully, my hopes for what it is that we're just able to provide more care for the greater population. Because we say all of this, but then there's still such a high need for dentistry in the world, and oftentimes the patients that we are treating and seeing are only a small sample of that entire population. So hopefully we're able to treat more people and service more people, and just overall improve the oral health of the world.
amazing. I think
Hmm.
almost not having an answer is an answer, right? This
Yeah.
this group, this cohort of dentists coming in are just so excited they can't imagine the possibilities. Whereas before we might have said, oh, this thing's going to improve, but actually not knowing what could possibly happen is proof that there's so much exciting things about to come. And I
Hmm.
I suppose my final question
Mm.
is trying to give some advice to practice owners who want to attract and retain those that
Mm.
early career talent. I think we spoke about it at the beginning, like, um, recruitment is a big problem in dentistry,
Mm.
and the
Mm.
young dentists are what's going to solve that, right? Getting them in, and but how do we get them in? So what's that one piece of advice you would give to practice owners today to attract that young talent to their practice?
There's a difference in mindset and attitude, which we've alluded to quite a bit throughout the episode, of these different generations. But previous generations, I think people may have just seen, oh, my job is my job, right? I come to work, I do my job, I get paid, that's it. But with these younger generation dentists, there's a lot more of our identity and purpose tied to it. And people come to work, and it's not just do my job and go home. I need to enjoy my job, right? Whereas previous generations would be like, you don't have to love your job, you just got to do it and do it well, and kind of just suck it up and get on with it kind of thing. But these younger generations, like they've got so much this drive and optimism, right? And this hope, and it's those bright-eyed individuals that want to change the world, who have all these ideas and that creativity and all this untapped potential, and they want to feel like they have a purpose. They want to feel valued and they want to feel supported and nurtured within that practice. And so I think that's my piece of advice for these practice owners, is to invest in that potential, right? To have sit down with these new grads that you are hiring and just have conversations about, what is your goal? What do you want to do? And I keep coming back to my practice owner, my boss, being such a huge role model and someone who I think is such an incredible leader, because like within our practice, there's maybe like 14, 15 of us dentists, and he'll have these chats with us each year where it's just a review session. And I always feel so good leaving these sessions with him. And I say to him, like, how do you like, are the review sessions the same for all 15 of us? And he says, no, they're very, very different. Where we have these review sessions, whether it's at a park, at a cafe, in the office, is like, it's dependent on the dentist, and it's dependent on, what they need and what their motivators and what their drivers are, because everyone is different. Some people, may be looking for a purpose. Some people may be just looking to have a high earning potential. Other people want a really good work-life balance. So it's figuring out what it is for that dentist and then helping them figure out those goals that they have, kind of have like, what is their vision for themselves, and then sharing like what your vision is for your practice, and then seeing if those align. That's really it. Is I think it's a lot more to just, does your resume match up with the job ad description? It's no longer just that kind of matchmaking of logics and facts and stats, but it's, as we keep coming back to, the soft skills guy, I can talk, soft skill side of things, right? And just the inspiration, the motivation, all of that. And I think new grads just want to be somewhere where they have that safety net of knowing that there's someone in their corner who believes in them, and wants to see them thrive.
Yeah.
Mm,
I think it's a really nice thing to end on there, like story of a real good leader that
mm.
focuses on the individual and not the task. I think that's really, really nice. So thank you for sharing that. Okay, well, this has been an absolutely fantastic episode. I've loved this conversation. I think we've touched on so many key points here,
Yeah.
from mental health to innovation to looking after those young dentists and nurturing that excitement for dentistry all the way through. But people are going to want more conversations like this. People that haven't heard your podcast before are going to want to know where they can keep listening and sort of add you to their drive to work, or add you to
Mm-hmm.
their treadmill workout. So, Erica, where can we find the Graduate Dentist?
If you enjoyed our conversation today, this is really just a snippet of all the all the yapping that I do on a daily basis. So I have the Graduate Dentist podcast. It's available on Spotify and on Apple Podcasts. It's where we release episodes every 2-3 weeks with a guest that I bring on the show, and we dive into just all these kinds of conversations. I also have my Instagram account at the Graduate Dentist, which is where I share on a more regular daily basis just my day-to-day as a young clinician, sharing the cases, the conversations that I have with patients, and just a lot of mindset and attitude advice and stories that I think are really applicable and important for our new grads.
Amazing. Well, I encourage everyone to go and follow everywhere. Send in questions to Erica on Instagram if you've got any. Make sure you're just sort of engaging with that content, because trust me, very, very wholesome. And like, if it's like Erica said, if you like this conversation, there's so much
Yeah.
more to be had there. Cool. So thanks, Erica, for joining the Spilling the Teeth podcast. I'm glad you like the name as well. That's fantastic.
Mm-hmm.
And hopefully we'll have you on in a few years' time, and we'll see how much has
We'll
changed since
see.
this conversation.
Yeah, absolutely. Thank you so much for your time today, Alan. Thank you for having me on.
Amazing. Thank you so much. See you soon.